What is the scariest example of medical negligence you've seen? 4. My mother's. She kept going to the on-site clinic at the university where she worked as a janitor, where all of the employees were encouraged to go because of lower co-pays. She was having pains in her arms and back that kept getting worse. She would call me, telling me, not really complaining, as that wasn't her way, that it was a strange pain that was all the way to the bones. Her PCP was a young, male doctor. I've never met him, but I like to imagine he had a handsome, punchable face. Every time she went in, he and the nurses would laugh off my mom's concerns. "You're not getting any younger, you know. Here are some NSAIDs, it's just arthritis." This went on for months, even when my mom would tell them that the pain was so bad she couldn't physically turn the steering wheel in her car. No blood work, no x-rays. Finally, it got so bad my sister convinced her to go to urgent care. One x-ray showed her bones lit up like Christmas with tumors. Stage 4 multiple myeloma, over 95% of her bone marrow involved, the most aggressive genetic variant. Over 2 years, she underwent 5 stem cell transplants, lost all her vitality, became a shell of the woman who had navigated a lifetime of trauma and abuse with humor and compassion. She died on a Saturday. It was cloudy and cold, and I left my 6-month-old daughter 1,000 miles away to be at her bedside. My beautiful daughter who has her curls and her mischief, and the same stubborn tenacity. My brilliant daughter who has no memory of a grandmother who would have set the moon in the sky for her. All because some arrogant doctor didn't believe a middle-aged woman and didn't want to bill the university's insurance plan for an x-ray because come on, she's probably just overreacting to some arthritis. After all, she was just a janitor. What could she possibly know? 5. I knew a lawyer who represented a young lady in her malpractice case, and won. She went skiing, crashed and broke her leg. The doctor set it and cast it, and sent her home. She kept complaining of extreme pain, but the drive told her, of course it hurts, it's a broken leg. Finally she called again and said it still hurts, and now it stinks. They brought her right in and found the leg had gotten gangrene. Bad, right? So they have to amputate the leg. During the amputation surgery that lasts many hours, the drive moved the good leg off the side of the table, which cut off the circulation, and for that many hours, killed the good leg. It too was amputated shortly after. She won a 7-figure settlement, but I can't believe it was nearly enough. 6. A friend was unable to pull her tampon out. She went to her doctor who also could not pull it out, but said that it would eventually come out on its own. I made an emergency appointment for her to see my doctor who discovered that lesions had formed holding the tampon in place. He managed to remove it. I wanted to go to her first doctor and say, have you never heard of toxic shock? She wouldn't let me, but I was angry that something as potentially lethal was ignored by a doctor. 7. I was administering an anesthetic to a patient for a hemi knee replacement. The surgeon had less than desirable skills not only in surgery but in life in general. The patient was a Medicaid recipient. He did an extremely poor job repairing the knee, such that her knee bent out at a 30-degree angle. I came from an orthopedic background and was appalled by his actions. I finally spoke up when I realized that he was going to close and leave her knee like that. I told him that I would refuse to wake this patient up until he corrected his mistake. Everyone in the room was scared at this point. He said, just what do you think that would accomplish? I told him that I would require the hospital director and the chief of surgery to come to the OR and witness his malpractice. He corrected his mistake. If he cared so little about Medicaid recipients, he should not take them as patients and should not accept the government, taxpayer, monies he received. The case law has shown that the anesthesia practitioner who renders the patient unconscious and therefore incapable of making informed correct choices must act as their advocate.